Speak into the microphone. Okay.
Listen.
Please come to order. Good morning. Welcome to the Commissioner of St. Mary's County meeting this date, Tuesday, June 4th, 2024. I am Randy Guy, President of Commissioners of St. Mary's County. Sitting to my right, representing the 1st Commissioner District, which includes Ridge, Piney Point, St. George Island, Mr. Eric Colvin.
Good morning.
Representing the 2nd Commissioner District, which includes Leonardtown, Hollywood, Mr. Mike Hewitt.
Good morning.
Sitting to my left, representing the 3rd Commissioner District, which includes Charlotte Hall, 7th District, Golden Beach, and Mechanicsville, Mr. Mike Alderson Jr.
Good morning.
Representing the 4th Commissioner District, which includes Lexington Park, some of California, Great Mills, and some of Hollywood, Mr. Scott Ostro.
Good morning.
Seated next to Commissioner Ostro at the end of the dais is David Weiskopf, our County Administrator.
Morning.
On my immediate right is Julie Birch, our recorder for today. Sitting at the table to my right is our Communications Director, Ms. Jenna Guzman.
Good morning.
Amy Carter and Andrew Beckman, our video media production staff, are behind the glass filming this today. So when you come forward, please look good. You're going to be on TV and recorded for this coming weekend. Please turn your cell phones off or on vibrate. When you come to the representative's table, approach by coming down the center aisle. And remember, this meeting is being televised, so you need to speak clearly and directly into the microphone for recording purposes. At this time, we'll have the invocation and pledge by Commissioner Ostro. Everyone please stand.
Most gracious God, we come before you today to ask you to help us with the decisions that we make, help us to make wise decisions, help us to truly listen to one another, help us to not act on what we think is right before we listen to all those concerned, before we seek you, before we as we seek you prayerfully in the decisions that we make. Help us to be good to one another. Help us to always listen to one another, and help us to respect one another throughout this county as a board and as citizens of this county, to respect and try to do what is best at all times. These things we ask in Jesus' name.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Ostro. Please be seated. Okay, at this time, we need the approval of the consent agenda.
So moved.
Second discussion.
Discussion?
Mr. Weiskopf, could you just kind of give us an overview of what this annexation by Leonardtown means?
Certainly. Mr. Hauser
Just,
is prepared.
it's a pretty important thing, and I
John, you
think
can sit over there. Yep. Nope.
Yeah.
He can present from there.
So Commissioner Colvin, commissioners received early May a request from Leonardtown to annex about 4 total parcels. They're situated just east of Cedar Lane Living Facility. There's a procedure in state law by which the town, with the consent of the property owners, can come forward and request annexation into the city's incorporated limits. So that means the boundaries of Leonardtown will be extended to cover those areas. As I said in the advance memo, which is in public record or on board docs, if the town and the property owners want it, there's very little, almost nothing that the commissioners could do to directly oppose that. The only people who could turn that down would be a referendum by the residents of Leonardtown, if I think 25% of them wanted to petition. What it means, we'll still get property tax revenue from these properties. They will become part of Leonardtown, will be subject to Leonardtown's planning and zoning laws if the annexation is accepted by the town. That's the overview. If there are any more specific questions.
What is the property for, Mr. Hauser? Do you recall?
One proposed use is going to be for a extension of Cedar Lane. That's going to be, I believe it was about a 72 unit new assisted living facility like what they have right there. The other property, just under 20 acres, that's just to the little bit east of that, does not have any proposed use yet. But the cover letter from Ms. McKay says that it is being eyed tentatively as maybe a future location of Leonardtown Fire Department's new home or relocation of their facilities.
Very good.
Now, this property is already surrounded by Leonardtown property already, right?
They're bordered entirely on the west by property already belonging to Leonardtown. They're bordered on the east by the St. Andrews Road property, about 20 or so acres that was annexed in 2020. County property is only going to be remaining on the north now, across Cedar Lane Road. There will be 2 single-family homes still on the southerly side of Cedar Lane Road that are not proposed for annexation and will remain unincorporated at that time. So there won't be any change to the livelihood or quality of life for those residents as a direct result of this annexation.
Thank you, Mr. Hauser. Any other questions, anybody? No. Okay, I have a first and second. All in favor? Aye. Any opposed? Ayes have it. Next, we have several proclamations this morning. One of them is for LGBTQIA month. For those involved, please come forward. And next for presentation will be the National Home Ownership Month also. I think you've got that.
I got that one. We got the first one.
So this morning we're presenting the LGBTQIA, and up here receiving is Mr. Brandon Russell, Tammy Gladstone, and Caitlin Freyer, president of PFLAG Southern Maryland. Whereas the diverse lesbian, gay, bisexual, transgender, queer, intersex, and asexual LGBTQIA community continues to contribute to the widespread academic, economic, artistic, and social spheres within and around our greater community. And whereas St. Mary's County has a diverse LGBTQIA community that includes people of all ethnicities, races, religions, and professions. And whereas St. Mary's County strives to be a safe space that does not tolerate violence, harassment, or hate speech. And whereas June marks 55 years since the Stonewall Inn protest in New York City, when patrons and supporters resisted harassment that had become all too common for members of the LGBTQIA community, and an event generally recognized as the catalyst for the LGBTQIA rights movement. Now, therefore, we, the Commissioners of St. Mary's County, do hereby proclaim June 2024 as LGBTQIA Pride Month in St. Mary's County, and urge all residents to respect, honor, celebrate, and strengthen a culture of inclusiveness and acceptance in our community. This date, June 4th, 2024.
Thank you so much, Commissioners. My name is Caitlin Freyer. I am the Vice President of PFLAG Southern Maryland. We are a local community group that strives to advocate, educate, and provide support to the LGBTQ community, their allies, friends, and family in the Southern Maryland area. We are out and about all of the time, and we are so happy to be here this morning. And we thank the Commissioners for allowing us, or for having us here this morning. And we just want to say thank you so much. And we're very excited to have a really great Pride Month. So thank you so much. Brandon?
Good morning, everybody. Brandon Russell. I am the Vice Chair of Pride Southern Maryland. I also want to extend my thanks to the commissioners and the county staff for having us this morning. It's a very important thing to acknowledge Pride Month, because as we've seen in our own community lately, there is a general and disappointing lack of respect sometimes for the people that we are and what we add to this community. And so this recognition goes much further than just the proclamation on the paper there. It really is an encouragement to everybody in the community to act with respect and treat other humans with kindness and respect. I also should mention that our local Pride event, Pride Southern Maryland, is going to be at Lexington Manor Passive Park once again this year. It will be October 13th from 11 to 4. And I think this is the third year we've been there. It's a great space. We always have a lot of fun. And a final note, I also would like to extend Pride, and I'm sure PFLAGs and everybody who comes to our Pride Southern Maryland event, extend our thanks to Mr. Tyrone Harris, who passed away earlier this year from the Parks and Rec Department. He was very instrumental in getting our event up and going in St. Mary's at Lexington Manor Passive Park over the last 2 years, and we really will miss his support, and we appreciate it. Thank you.
Okay.
Next, we'll be doing the proclamation for National Home Ownership Month. So if we could have representation up to Tanya Scriber, Helen Mattingly, Wernicke, and anybody else, any other realtors? Morning, everyone. I'm here to give the proclamation for National Home Ownership. Whereas home ownership instills a sense of pride, security, and comfort that no matter what challenges in life arise, one will have somewhere to go and call their own. And whereas home ownership should be available to all because it not only provides daily safety and security, but it also helps create generational wealth and is a central part of the American dream. And whereas the price of housing is skyrocketing for home buyers and renters, which makes it increasingly difficult for one to find affordable homes. And whereas the Southern Maryland Association of Realtors is committed to fostering and facilitating home ownership for all in St. Mary's County. And whereas St. Mary's County's home ownership rate is 71%, which is higher than the state average of 67%, but still leaves room for more people to access home ownership. Now, therefore, we, the Commissioners of St. Mary's County, do hereby proclaim the month of June 2024 as National Home Ownership Month, and we call upon all citizens to help safeguard the American dream by ensuring everyone has access to an affordable home in a community of their choice. This date, June 4th, 2024.
On behalf of the 1,500 Southern Maryland Association members, I would like to thank all the county commissioners for this proclamation. It is indeed important for fair housing for all of us, and I'm glad that St. Mary's kind of leads the way in that with the percentage of people that we have. So thank you very much.
So we need to get you for Christmas. Maybe back. Thank you. Wow. And then do I?
Next, you can tell we got a big crowd here for the next presentation, which is the Department of Human Resources with the Years of Service Employee Recognition. With Catherine Pratson, our Director of Department of Human Resources, will be giving out these awards. We got a bunch of people here today.
Yes, how exciting. Thank you, Commissioners. Thank you, Commissioner Guy. Good morning, everyone. It is my distinct pleasure to be here today to present the Years of Service Awards. This annual recognition is a highlight as we celebrate employees with 10 or more continuous service years to the county. The employees being honored this morning have spent much of their professional lives as public servants, and every resident of St. Mary's County has been impacted in some manner by the good work of these individuals. 57 county employees are being celebrated for achieving years of service milestones during 2023, and today we present the employees who have achieved 10, 15, 20, 25, 30, and 35 years of service to St. Mary's County government and to the citizens of St. Mary's County. We are truly humbled by the commitment of these individuals and thank them sincerely for their dedication to county government. And without further delay, for our award recipients, please come forward as I read your name. For the audience, please hold your applause until the entire year group has been called. And for the department heads and colleagues in attendance, please come forward for a photo once the group is assembled. For employees celebrating 10 years of service to St. Mary's County government, these include Susan Dean, Administrative Coordinator from the Alcohol Beverage Board, Judy Wallenfelt, Court Reporter from the Circuit Court, yeah, just please, thank you. Virginia Quaid, Food Service Technician for the Department of Aging and Human Services. Jack Williams, STS Driver for the Department of Public Works and Transportation. John Curtis, Manager of the Solid Waste Division for the Department of Public Works and Transportation. Todd Rice, AS400 Program Analyst for the Department of Information and Technology. And Rachel Pulliam, Risk Manager for the County Legal Department. If any other members of the 10-year group are here, please come forward. All right. Please. Yep. Rachel's leaving. Yeah, I don't think so. Congratulations to you all. Just a second. Thanks for your contributions. Employees celebrating 15 years of service to St. Mary's County government include David Weiskopf, County Administrator, from the Office of the County Administration. Ralph Broom, Capital Projects Manager, our planner from the Department of Public Works and Transportation. Sonia Stats from the Department of Finance, Budget Analyst. Brandy McKelvey, a paralegal in the County Attorney's Office. Charles Holtzberger, Court Security Officer for the Sheriff's Office. And Lindsay Irving, Correctional Officer Sergeant for the Sheriff's Office. any other members of the 15-year group? If you're here, please come forward. And congratulations to you all. Thank you for your many contributions to our community and to our organization. Yeah, you have to stay. Employees celebrating 20 years of service to St. Mary's County government include Linda Baird, Administrative Coordinator for the Department of Public Works and Transportation. Joanne Copsey, Coordinator for the Department of Public Works and Transportation. Jennifer Talton, Application Programmer and Analyst for the Department of Information and Technology. Sarah Smith, Captain, Sworn Law Enforcement Officer for the Sheriff's Office. Michael Thompson, Corporal, Correctional Officer for the Sheriff's Office. Thank you. And if there are any other members of the 20-year group, please come forward. Yeah. And congratulations and thank you all for your many contributions to our community and to our organization.
And then I think
Please, yeah, and if there are any other department heads or colleagues that want to come forward and join the group, please do.
Yep, you gotta go. I can always count on Commissioner Hewitt. He's Thank you.
Congratulations. Employees celebrating 25 years of service include Valerie Hayden, Fiscal Specialist for the Department of Recreation and Parks. Oh, did you come? Okay. There you are. Robert Bailey, Maintenance Foreman for the Department of Recreation and Parks. And Doug Mills, a lieutenant, retired and currently working as a contract deputy for the Sheriff's Office. And are there any other members of the 25-year group? Congratulations to you all, and thank you for your many contributions to our community and our organization. All right. Yes, please. Any other department heads and colleagues that want to join, please do. I think we have a couple more coming up for pictures, if you don't mind. Oh, no? Okay. Oh, just taking them. Congratulations to you all. Just a couple of closing remarks. David Oliver is a senior groundskeeper at Wacomico Golf Course. He's celebrating 30 years of service. And Gary Hawley, an equipment operator for the Department of Public Works and Transportation, is celebrating 35 years of service. They are not. These gentlemen are unable to join us today. And to them and to all who have achieved milestone service, we celebrate you and are grateful for your continued support and commitment to the county. Oh. Sure.
Happy to.
Sure. Sure. Thought you were going to get out of it.
My.
Hi. Thank you, commissioners, for the opportunity to recognize these valuable employees. And thank you to Deputy Director Tracy McPherson for organizing this wonderful event and for the support of the fabulous HR team. So thank you.
I'm going to call you up there for the picture with your mom.
But next time, you know I'm going up there.
Oh, yeah.
See if all of the kids can come. There's 6 of us.
Oh, yeah.
From work to
Bad shopping cart.
Just a reminder, we got to go into Board of Health. So we motion.
Is she here?
Yes, and turn it on. It's off right now.
I don't see her yet.
So I might have you
There
hold
she is.
it.
Yeah.
An indoor
Oh,
one.
there she is.
Hmm? The public hearing,
Yeah.
it's the opening remarks are in the beginning.
Or you can send Buffy. Buffy could help you if you need extra
No, I
hand.
just, I'm right here.
Knew that.
Right here.
Coming for the public hearing, when you get to the public hearing, which is here. Somewhere, there's the opening remarks.
Public hearing, okay. Okay, next I need a motion to adjourn as Commissioner of St. Mary's County.
I move to adjourn as Commissioners of St. Mary's County and reconvene as the St. Mary's County Board of Health.
Second.
I have a first and second. All in favor? Aye. Aye. Any opposed? Ayes have it. Why not have Dr. Brewster come forward, please, and present her briefing. Good morning, Dr. Brewster.
Good morning.
Good morning.
Thanks so much for your time this morning. Our briefing today for the Board of Health is really going to focus on three main topics. I'll start off with an emerging public health issue. We just want to make sure you're up to date on information related to that. And then provide some updates on the initiatives that we've established here in the county to expand healthcare access. And then I'll wrap it up with updates from other community health efforts going on that the health department's involved in. The first is the emerging public health issue, and that is H5N1, which is a type of influenza. Influenza has a variety of different strains or types of virus. H5N1 is one type. It is commonly referred to as avian influenza or bird flu. There are various different kinds also of bird flu. This is one of them. The reason why it's typically referred to as bird flu is that it's largely an infection that impacts wild birds, particularly water birds, and has also for many times infected commercial poultry and backyard flocks, such as backyard chickens. Right now, the world actually has been experiencing an increased number of cases related to H5N1 in commercial poultry and in wild birds. We've also seen multiple states across the U.S. over the past couple of years that have had their commercial poultry flocks affected. And you can see here some of those numbers. Actually, these numbers, since I turned in the slides last week, these numbers have also increased. The poultry affected are now nearly 97 million here in the across 48 U.S. states, and that includes Maryland. The locations in Maryland that have commercial poultry are the higher risk ones. We also, in this past year, 2024, have been seeing that this infection, which traditionally is a risk to wild birds and commercial poultry, also has the potential of infecting mammals, and particularly mammals exposed to infected birds, and that includes humans. But what we've been seeing in 2024 is an impact on dairy cows throughout the U.S. There are 9 states that does not include Maryland, to our knowledge. There are 9 states that have been reporting their dairy herds affected. These numbers of 67 were from last week. We're now at 79 dairy herds as of yesterday affected, still in 9 states, not including Maryland. The closest states involved to us are Ohio and North Carolina. Jenna knows exactly when to advance the slides. She's well experienced in this. Thank you, Jenna. So what we're looking at from a public health perspective is the potential for this infection to impact people, of course. And so that is why we are monitoring this. We're involved. I'll talk a little bit about some of the actions we've taken along with our agricultural partners to prepare in case this does become a larger issue affecting people here in the country. We're trying to prevent it from becoming a larger issue affecting people. H5N1 influenza, or as I'll refer to it as H5N1, and up in the corner, we have created as a health department a web link or a website where people can get more information, get links to resources for different target groups. All of that's there, and we'll continue to build that out as more information becomes available. So H5N1 in the U.S., we have seen 4 cases. It says 3 here on the slide. This was updated this past Friday. There are now 4 people who've been affected by the current H5N1 influenza outbreak. They've been infected.
In the U.S.
In the U.S. In the U.S.
Any cases in St. Mary's?
No cases in Maryland. No cases in Maryland, and I'll go into that a little bit further. 3 of those cases have been associated with exposure to sick or infected dairy cows. 1 was exposure to poultry, which was a little bit older. The 3 were here actually just in the past couple months, starting in April. However, we have not seen the infection, right? And some of this it is totally based upon people reporting symptoms and getting tested. So in the beginning of any type of issue where viruses are emerging, where we're starting to see cases, we always assume that there's probably some level of infection and transmission that we're not aware of because we don't have, because generally people may not be aware, or they may not know how to access testing, or they may not be able to, we may not have the system set up to make testing easy for them. But even with those who've been tested, we have 4 cases. If you go to the next slide, Jenna, please. What we're most concerned about, the people who we are most concerned about, are those who have exposure to infected or possibly infected poultry or dairy cattle, because of course those are the animal populations where we're seeing the infections the most. We do not have any human cases that we know of in Maryland at this time. And again, we have not identified any cases affecting herds of dairy cattle in Maryland at this time. And certainly in St. Mary's County, we have not identified illness in, of course, commercial poultry. That doesn't affect us as much. But dairy cattle, we have about 25 farms here, 30 to 40 cattle each or so. And we haven't detected any concern of illness right now in any of our dairy farms.
Dr. Brewster, what's the, is there a course of treatment for the infected animals, or do they have to?
Yes, so there is treatment for humans. I'm not as familiar with the veterinary treatment. I do know that the symptoms can be pretty significant in birds. We haven't seen the symptoms be as significant in cattle or mammals like humans. But the potential for it to be significant and potentially even fatal is there. In birds, H5N1 is referred to as what's called a highly pathogenic influenza in birds, and that is because it is highly contagious and it can cause severe illness and lead to fatality. So a lot of times when we're monitoring animals that are getting sick or that we're monitoring them for signs of sickness, they are isolated quickly, evaluated quickly because of the potential impact to the rest of the flock or herd.
So I have a backyard flock of chickens, and everyone who has backyard chickens should be practicing good biosecurity when it comes to this, because this is real. Nobody wants to have to put down their
Absolutely.
whole flock.
And backyard chickens, some backyard chickens share environments with wild birds.
Exactly.
And we do know that wild birds, particular, not really songbirds as much as the water associated birds, but wild birds are significantly impacted. And it's kind of a bird flu transmission, or H5N1 in particular, is definitely happening in the wild bird population. I'll talk a little bit about specific groups and some precautions they should take. For right now, our major concern, of course, are agricultural workers who are exposed to commercial poultry, particularly, and dairy cattle. I'm really grateful for the work of University of Maryland Extension Office, who's been communicating regularly over the past few months with our local farmers and dairy cattle, with our Amish and Mennonite population who operate a cheese house and also have some feed mills. Our team also is communicating with those farmers just from more from a human prevention perspective. We'll be mobilizing some protective equipment as well for some of the farm workers who are in certain settings. So the major symptoms of bird flu in humans, just so the public is aware, is very similar to the symptoms of influenza, right? What we have seen thus far in the human cases that have been identified with H5N1 is that conjunctivitis, or redness of the eyes, possibly tearing, possibly discharge from the eyes, is a very prominent symptom. That is something that we are trying to get the message out to all of our agricultural workers, because they may not know right away when there is a sick or infected animal. There is testing happening. There's certainly testing happening anytime dairy cattle are moved across state lines. But sometimes the exposure is happening before you realize the sickness is in the animal.
Dr. Bruce, tell me, we've heard instances where they found bird flu somewhere and they kill 3 million chickens or some outrageous number like that. If humans get it, is this a fatal something?
So it's highly pathogenic, which, as I was describing, it can cause severe illness in birds, and it's highly contagious, which is why a lot of times they call the population of birds because they don't want it spreading.
Get it, but if I
even
get
beyond.
it, am I
For
likely
humans,
to die?
it often, at least when we've seen cases before, and keep in mind that there's only been a small number of cases thus far associated with this. In humans, it's not necessarily causing severe illness or fatalities. However, there is a possibility that it could, or with time, as things grow, we know when viruses grow, as we saw with COVID, they also change. And they can become more significant and cause more
Okay,
significant.
so it's more of an animal type of a issue than a human issue.
Right now, that's what we're seeing. But we have seen 4 cases of humans thus far with this that have been identified.
And I would assume this is much more dangerous for our elderly and
Typically, influenza is. Just like a lot of illnesses, typically influenza is more dangerous for people who might have some kind of underlying health issue, like asthma, for example, children, including young children, as well as seniors, or in people who have chronic illnesses, other chronic illnesses that compromise their health status, may even compromise their immune system.
Now, you say 97 million chickens have been affected by
For
this?
commercial poultry.
Well, we that are not exposed to live chickens as much, so we could be concerned when we buy a chicken at the store?
So the beautiful part of the system that we have right now is that there's a lot of food safety measures that have been implemented by both USDA and FDA at the national level, particularly when meat or milk enters the commercial supply. They make sure that the milk is pasteurized. Pasteurized milk will kill viruses, including influenza virus, as far as we know. And we do know that unpasteurized milk or unpasteurized milk products, that's where we carry the highest risk of getting infection or illness. There's all kinds of illness from that we've seen from those products. Meat as well. If we're preparing meat and we're ensuring that meat from sick cows is not getting into the commercial food supply, which that's part of what they're monitoring right now, and we're making sure to prepare and cook that meat to safe internal temperatures, it's supposed to...
So if I cook my chicken to 165 degrees, it'll probably kill off the virus.
Well done. Yes, 165 degrees
Just
Fahrenheit.
Just want to make sure, everybody know that. Cook your chicken to 165 degrees
Thank
and
you.
kill it all off. All
For
right.
a built-in PSA there. Thank you. And also, to prepare the food properly. Wash your hands, keep uncooked food separate from cooked food, so forth.
So even if we buy this chicken packaged in the store, we should be cautious.
So right now, there's a lot of monitoring. So if there's any sign or potential of a poultry stock, a poultry flock being infected, they are not passing that meat into the commercial market, right? That meat's not getting into the food supply. That is exactly right. And those measures are there, and there's a lot of scrutiny on this because of this ongoing issue. But certainly, we should always be aware of what we're purchasing and making sure to prepare our food properly.
Do we have that many people getting unpasteurized milk products?
So we have, I believe, 2 raw milk licenses here in the county. There are some individuals consuming raw milk or purchasing raw milk at least. I don't know if they're then pasteurizing it on their own by heating it, or if they're just consuming it as straight raw milk. Our cheese house, I think the Amish cheese house here is all pasteurized cheeses and pasteurized milk products, so that should be taking care of any type of bacteria or viruses that we're typically concerned about in unpasteurized milk or cheese products. We're still learning about the risk of this virus infecting people if they consume raw milk and raw cheese products, right? So that's still an area that's being investigated. But what we know from our prior experience with bacteria and viruses is that raw milk and raw cheese products are the ones where there's the highest risk to a person.
There's no case in Maryland right now, but we do have, I say, farmers in the area that do make their own cheese, which is very, very good.
Yeah.
Just wondering, do we monitor them somehow that they're using pasteurized type product versus?
We're not testing
Okay. I'm just wondering.
at that level. There is periodic testing of dairy cattle, right?
Okay.
But obviously, we
But no
want our
case somewhere
farmers to be monitoring their cattle and their poultry to ensure that they're not exhibiting any of the signs and symptoms of influenza infection in their herd and in their flock. Again, our partners at the University of Maryland Extension Office have really been working hard to make sure our agricultural community is well aware of what's going on, and we're also sending out and getting resources out to our
Good,
agricultural partners.
Okay.
Thank you. So again, just our focus from a public health perspective is really anticipating, preventing, mitigating any exposure to people. And of course, as a local health department, we're honing in on our St. Mary's County community. So in that, part of the work that we're doing right now is to prepare, right? As we do anytime there's an emerging public health issue, hopefully it doesn't become a major issue like what we saw with COVID, but it is, we need to prepare and ensure that we are getting our partnerships, communications, testing supplies, all of that ready in case it does grow and establish. Again, there are no known human cases of H5N1 in Maryland. We have seen affected poultry, and Maryland is one of the states with affected poultry, but we haven't seen dairy cattle yet in Maryland affected. So we
Dr.
do
Brewster,
have.
Just one other question. It's
Yes, sir.
probably a stupid question, but I'm going to ask it anyway.
Okay.
Is this solely something, a disease that is that will remain within cattle and or chickens
No.
or birds? Is there a risk of something like this jumping to perhaps the deer population? We have a lot of deer hunting going on.
We have seen mammals affected, so there is that potential risk. I'm not aware of cases within deer, but there certainly is that risk. We saw it with COVID, that deer populations were getting infected with COVID. A lot of mammals previously that have been infected with a bird flu type comes from being and sharing resources like water sources, being in the environment with sick birds, eating a dead bird, that might be out in the wild or so forth. We have seen goats affected with illness, barnyard cats, for example, and other mammals. I'm not aware of how it might go into a deer population, but I can certainly look into that. So there is treatment available for influenza. Influenza is not new to us. This is a different kind of influenza that we don't often see in people. And the fact that more and more animals are getting sick makes us concerned about the exposures to people and the virus essentially jumping into people. And then when we get really concerned is, of course, when that infection starts spreading between people. Then it becomes much harder to control. Right now, we're really focused on making sure people are aware of the situation and just kind of keeping it in their mind or in the back of their mind. And if they have any exposures to sick or ill animals that they think may have been sick from H5N1, or if they've been exposed to an environment where they've been sick, poultry or dairy cattle, for example, suspected to have H5N1 or confirmed to have H5N1, they are the ones we're most concerned about. And so if somebody's had a concern about exposure because of that exposure to a sick animal, then we would want them to monitor their symptoms for 10 days. It could take up to 10 days for them to start displaying symptoms of the flu since their exposure, and to isolate from other people and to seek medical evaluation. And of course, we'll be notified as a health department since this is an emerging public health issue. So we have testing available for this. In fact, we're coordinating with the state health department to ensure that testing kits are available here in St. Mary's County. So if a case does happen, or if a concern, I should say, does occur with a person who may have a risk of H5N1 exposure, for example, a farm worker, we now have or will have the testing supplies to be able to test specifically for H5N1. And we'll, of course, coordinate with the state health department on that work. Thank you. So I mentioned some of the things we've been doing already. I think right now our focus has been communications, making sure people are aware, making sure we get prevention resources out to our higher risk groups like our farm workers, and communicating with all of our partners who are involved in preventing cases from happening here in humans in St. Mary's County. And that includes our clinical community. So all of our physicians and emergency room and urgent cares where people might show up with symptoms, we're communicating with them. We're trying to get messaging out to them. The health department at the state is also doing some communication with all of them to ensure that they understand symptoms and what kind of testing is indicated and how to report.
How contagious is this if it gets into
This is considered highly contagious in birds. We're less aware of how it acts in humans because we haven't seen it as much.
Not like a COVID thing where
Thus far, it hasn't been that way. What we're always concerned about is anytime viruses like this begin emerging in a population, get established in a population, particularly when they're spread between people, person to person spread, viruses change and they can become more contagious or even more severe in their health impact. We saw that with COVID. And so there are things emerge, and that's why it's important for us to just keep a close eye on how things are emerging around the country. And we're also looking into our personal protective equipment to see what we can mobilize to higher risk community members. Thank you. I did want to raise this. This is an initiative we've had going on since COVID. If you remember, we began doing some wastewater surveillance in the county for COVID virus just so we could better anticipate where an outbreak might be developing. Particularly early on in the pandemic, it was very, very helpful in focusing some of our testing resources. This wastewater, essentially the concept behind this, if you recall, is there could be pieces or fragments or a skeleton of a virus, right, that can show up in feces. And therefore, when you test wastewater, the levels of that might be an indication of something developing in a community across many people before you start to see tons of people flooding urgent cares and the ED and asking for testing. So it's a bit of a heads up that allows us to prepare our resources and our healthcare providers. We are no longer doing the countywide wastewater surveillance we were doing during the pandemic. However, there is a national effort which we've partnered with to do wastewater surveillance through the Marley Taylor water plant. And that orange distribution there is, of course, a distribution of that wastewater treatment plant. In that national effort, all the infections listed here are ones that are being monitored periodically. There are many sites across the country that are participating in this national piece. I did want to draw your attention that it includes influenza. And so what we're doing right now is finding out from this national project how specific that monitoring is related to influenza A, which is the kind of influenza H5N1 is. And so as we learn more information about whether this wastewater monitoring is helpful, we will relay that back to our community. But if people are interested in learning more about it and seeing what the levels are of different viruses and so forth, based on that single test, they can go to our website, which is highlighted up in the corner.
Are you seeing any significant emergence of viruses in our wastewater?
You know, it was respiratory season, and so we saw a lot of various types of things you typically see this time of year. I know there have been different types of sicknesses going around the community, including stomach bugs and other, cold type symptoms and so forth. So a lot of these viruses listed here could be implicated in that, and we saw some fluctuations in that. These aren't measured every day or every week where it gives, but it is an indicator. So it's something that we check in on periodically. But most of what we were seeing wasn't out of the norm for what we typically have during a respiratory season.
So what kind of actions, excuse me, Phil, what actions would you, would be prescribed if any of these diseases are detected in the wastewater? Just public information?
So this is an indicator. It is something that is a clue, but it's not the whole picture. So what we would do is if we saw a clue that made us concerned, we would look at it in the context of other data. We'd start looking at our urgent care data, our emergency department data, whatever data is available to us about what types of symptoms and illnesses seems to be more kind of developing in our healthcare environments, we would partner and probably look into it by speaking with some of our healthcare entities like the hospital or like healthcare providers to see what they're starting to see in their offices more and more. And if all of that, if that picture goes together and goes on, depending on what the issue is, we might do a public notice and we might do an advisory that we're starting to see higher levels of RSV, for example, in the community. We haven't, but that would be an example of something we'd give an advisory about. We'd probably notify our healthcare providers so that they have it more in their minds when they're seeing patients and can be aware that this is more in the community. Maybe it's something I should be more concerned about in my patient.
Or you advise
I'm sorry?
Marley Taylor to put more chlorine in the water.
Well, so this isn't, this isn't
We
getting
need
back
to
into.
kill off these things before they get out in the environment.
Yeah, this isn't, keep in mind that these typically aren't live virus, right? Most of these may be inactivated. They might be skeleton pieces of a virus. It's an indicator. It's not.
You mean the dead come alive again?
Yeah, and hopefully nobody's going swimming in the wastewater or anything like that. I mean, this is clearly, we have a wastewater management, treatment plant because they know how to treat the water to make sure it's safe to be recirculated.
Dr. Bruce, we don't want to scare the people to death here.
Yes, agreed.
Please.
Yeah.
Please, we don't need to do
Don't
that.
go swimming in the wastewater.
Yeah.
So I do want to transition now, unless you have any further questions on the H5N1 issue.
No.
I do want to transition now to talk about some of those initiatives that we have going on to improve access to healthcare in our county for our community members. And thank you, commissioners, again. You've been incredibly supportive of improving access to healthcare for our community members. I know it's very meaningful and has impacted many, many lives. So thank you very much for that support. Our school-based health centers, as you know, we have two, Spring Ridge Middle School and Margaret Brent Middle School. There's some summary information that you've heard before, but just as a reminder for the community, people can enroll very easily online. Once you're enrolled, you can go to any of those school-based health centers. You can call to go in. Oftentimes, we have same-day appointments, particularly if you call in the morning. For the public school students and staff, when the schools are open, we're restricted to seeing public school students and staff from any school. It doesn't have to be the host school. After school dismissal, which for those two middle school tends to be around 2:30, we are open to the entire community. You do not have to be affiliated with SMCPS, and again, it's all ages.
Now tell me, I had a question on that. So the general public can come after school's out until what, 5 o'clock?
Right now, we're operating, I think, until 4:30.
8 to 4:30.
So 2:30 to 4:30?
It's 8
a.m.
yeah,
to
2:30
4:30.
Yeah,
4:30
but
for the
do you
general
want
public.
people to come during the school day? Doesn't matter? Like if the
I'm sorry?
general public wants to come,
Sure, they can come between 2:30 and 4:30.
okay, but they don't come during the school day?
Not during, unless they're affiliated with SMCPS,
No,
right?
I get
Because
it.
the school
See,
campus
only
security.
2:30 to 4:30. I get it.
Yes.
Thank you.
Parking,
Then all summer long.
security, and so forth. Yeah. So if you go to the next slide, though, well, actually, let me talk this first, and then I'll talk a little bit about what's happening over the summer. The pie chart slide. Thank you, Jenna. The school-based health centers, so far, just to give you an update on utilization. Again, we've been operating now for fully, really, for about a year and a half, but it's been in place, of course, for a couple years because we were using them largely to support our pandemic response earlier on. So these are the number of individuals enrolled, and you can see the distribution across public school students is the lion's share of the number of individuals utilizing the school-based health centers. This is the beauty of a school-based health center. Parents can stay at work. Their kid can come over and utilize the center. We will communicate with them. We'll communicate with their primary care provider in the community. And if they are well enough to return, we will get them back to the classroom. And the same with school staff. And we've had a 40% eligible for school return to the classroom during this past school year. That's significant because
Very
I'm
good.
sorry,
That's
because
very
the
good.
alternative is sitting in an urgent care for several hours often.
But tell me, if it's students at Ridge Elementary or,
Yeah,
you
their
know-
parents would have to bring them.
Okay, so
Yes.
that's how it works.
But because of the easy access, because there's not a wait, right? It's not if for those students who are coming from other schools, if they have somebody bringing them from that other school, of course it would affect the parent. Then would need to bring them, or somebody would need to bring them. But it's not going to be a 4-hour experience
No, I
like you'd
get
see
it.
in
But
our
I'm sure they have to bring insurance and copay. and-
Usually in their enrollment, we take all, for the most part, all health insurances. We've credentialed with them. I think we're either complete or about to be complete credentialing with Humana, which used to be TRICARE as well. That was the toughest one. But if somebody doesn't have health insurance, we will see them as well because we're a health department and part of how we operate is on an income-based sliding fee. I'm sorry?
Don't have to have health
They do not have to have health insurance.
We will
Correct.
see everybody.
We will see everybody. Yes.
And along those lines, I think one of the goals is to get these centers self-sufficient and
Yeah, although as we talked about before, it's hard to become self-sufficient when you allow seeing people without health insurance
true,
or you
true.
adjust your fees based on income or you have a restricted population, right? I mean, during school hours, we have a restricted population of people we can see. So it often means that we may have lower volume than you would see in a primary care practice, which is great for the people coming in. That's why we can get them in and out very quickly. And they're not waiting and they have a wonderful experience walking into that space. But it also means that the opportunity to get reimbursement for care if they are health insured is lower for us. So typically school-based health centers will have a hybrid funding setup where they will, over time, as you get established over years and as the community knows about the services and starts to use it more, they will continue to bill and get what they can from health insurers. But then they usually rely on other funding to subsidize that so they can continue to provide care to everyone.
Are you able to do that through federal and state grants to help this out?
Yes, we actually have a couple grants right now. Commissioners, as you know, you're supporting the school-based health centers as well.
Very good.
But we are constantly seeking grants to support the work of the school-based health centers.
Very good. Very good.
We do a lot of braided funding at the health department.
Do you run into any hurdles with non-emergency treatment for unaccompanied minors?
So not really. I mean, that's a lot of what we do, right? Is we do a lot of non-emergency treatment. If somebody's having a medical emergency, they should be using an emergency department setting. If minors are enrolled, the way school-based health centers are set up in Maryland is that we are able to see them unaccompanied by their parent. We will, of course, contact the parent and keep them informed. And typically, the school nurses start that process before they even send the student over to the school-based health center. That's the whole point of enrollment. We get the parental consent during the enrollment process. And that's why it's a good model because it lets parents stay at work and we communicate that with them. And then once we know what's going on, then they can take whatever action they need to take, whether it's coming to pick up the student or we're allowed to return the student back to the classroom.
Well, I've said it before, and I'll say it again. This is extremely convenient, especially when it comes to sports seasons. When you get a flood of physicals coming in.
Yeah, we have amazing primary care clinicians in our community, but they are very full because we don't have enough for our population. And so it often takes weeks, months even to get an appointment, even when you're established as a patient. And when you add in the busyness of sports physicals and school physicals and catch-up vaccine clinics and so forth, I mean, that's a lot of demand on our limited primary care clinicians in this community. And so again, our effort in opening up these school-based health centers was to alleviate some of that burden on our primary care system so that people in our community can still get the care they need and get those sports physicals when they need them. Go to the next slide, please. Thank you. So as you were hinting at earlier, school's not in session during the summer, but we are. So the school-based health centers will be open to the entire general community of St. Mary's during all hours that the schools are closed during the summer. So we are, individuals need to enroll, whether they're a member of the general community, an adult or a child, or whether they're a member of the school system. They would need to enroll. Once they're enrolled, then we're able to get them scheduled for appointments. We're doing sports physicals, lots of things that people would normally go to their primary care office or an urgent care for. We'll take care of that. And also manage chronic illnesses as well. And for some people, we serve as their primary care clinician. We will be their ongoing primary care provider if they need one. We are excited because we're working right now on getting clinicians to start offering behavioral health clinicians at the school-based health centers. The incredibly short supply nationally of behavioral health providers, mental health therapists, and so forth, especially the ones that deal with children and adolescents. But we're trying, and we hope that we'll be able to have some in place for next school year.
I see one thing you got on here now. There's been pros and cons about the RSV vaccine. How do you feel about that? Should people be getting it at a certain age? Everybody get it? Or
Yeah, so it is definitely recommended as one of the childhood vaccines.
childhood vaccine?
Yes, and in the childhood vaccine schedule, for women who are pregnant, for ones who are around young children in particular, we want to make sure our immunity is strong. A lot of this is a personal decision for people to make with their.
But the elder community, should they?
Yes, again, a personal decision for people to make with their medical provider, because there may be other things factoring into that decision. So I'm hesitant to make a broad statement, but yes, I mean, it's certainly
Pros
part of
and
the
cons
childhood
about it.
vaccine
Some
schedule.
people said, no, I'm not going to get it. Others say, oh, yeah, you should get it. And I haven't gotten it yet.
Yeah, I would encourage, if somebody has questions about it, we certainly have information aplenty through websites and so forth, but I would really encourage them to have that personal conversation with their physician or clinician.
Dr. Russo, tell me about utilization of these school-based health centers. I mean, they sound expensive and sound like a great idea, but how busy are they?
So we have seen volume tick up. We're only in our, we just kind of completed our first year. So typically for anything that you have a primary care type of service line, it takes several years to establish capacity. A lot of people still don't know about the service being available.
I agree. A lot of people don't know.
But we are seeing use pick up. We saw a lot of use during the respiratory season when it was very convenient for families to come in. And whether it was the general community after school dismissal or during the school year, we saw, as you saw, 70% of who we saw were students within SMCPS. So we did see a lot of use and development and growth of that utilization over this past school year. We are expecting to see more and more people as we continue to build awareness about the availability of this.
Let me stop you there. When you say build awareness, how are you doing it?
So we've been sending messages out. We do communications like this. Honestly, when I give updates to you all, I have the QR code there because I'm hoping people watching will check it out. We know our school nurses are very well aware of what the school-based health centers do, and so they communicate that option to a parent when there may be an opportunity for them to use it. We've sent out communication to parents when we launched the school-based health center in conjunction with the school system. We put out messages to the community through social media, through radio ads, through other types of ways of getting information out to our community. Anybody who enrolls, we give them updates once in a while periodically as to what, for example, that we're open all day to the general community during the summer. So they've received that information as well.
All right. Well, I just know that healthcare professionals are just busy everywhere you go.
Yeah.
I just, when I see 17% general population using these, it just makes me think there's some people who are vitally needed that aren't being used, and that's what worries.
But keep in mind, it's only 2 hours every day, right, that we're open to our hope is that we can expand into evening hours and even put in weekend hours, but that requires resources to do. So right now, we're just really trying to establish the volume during the hours that we're in operation and build awareness in our community. And as our volume continues to increase and that demand continues to increase, and as I said, we're constantly looking at grant opportunities that might help us expand into evening hours.
Takes a while to get it up and running.
It does. It does. And
Everybody listening should go to St. Mary's County Health Department /SBHC.
Thank you, sir.
And make an appointment.
Thank you. Thank you. It's definitely a very helpful option for people.
Yeah.
And it is tremendously convenient. We have wonderful, wonderful clinicians and teams staffing.
We got 2 nice facilities there. I'd like to see them used more.
Yeah.
Me too.
Okay, the other major initiative to expand healthcare access and wellness overall actually is the Health Hub, as you're well aware. Jenna, do you mind? Thank you. Whoops, not that way.
Wow.
Sorry, it won't
It's
let me
okay.
skip.
Okay.
Yeah, it looks
It'll
good.
come
Like me.
eventually.
How do you sleep at night?
Healthcare can seem out of reach, inconvenient, too expensive. Not at the St. Mary's County Health Hub. Located in the heart of Lexington Park, we offer St. Mary's County residents a full range of health and wellness services, from 100% free walk-in crisis counseling to primary care appointments. So come in and see us. Our goal is simple: total wellness for all.
Good message.
Thank you, Jenna. And just like with the school-based health centers, at this point in time, the Health Hub, for the large majority of services through the Health Hub are free, and we're not actually enrolled with health insurers, so we're not charging health insurance either. So really anybody can come in. The primary care provider in the Health Hub is a partnership through Greater Baden Medical Services. They are, as I've mentioned before, a federally qualified health center, which means that they take all people regardless of their health insurance or their ability to pay. And that was really important to us because we were really trying to open up more primary care access for people who might not have the premium health insurance or might prefer something that is open access for them.
We only have one of these, is that true?
We only have one Health Hub, yes, currently.
Lexington Park.
One in Lexington Park. Yeah, we're working on a plan to develop more behavioral health crisis services in the northern portion of the county, but that's a little while away.
Okay.
I'll talk more about that once we get things firmed up. So there's a variety of services, as you know, at the Health Hub. We're continuing to grow those services. And again, it's very easy for people to enroll and get access to those services. They can use this QR code on the slide, or they can go to the website or give us a call. The website has information about phone numbers and so forth to do that. These are services, it truly is a huge partnership effort. And I know Commissioner Oster, you know, because you were recently at an event where we celebrated our partnerships involved in the Health Hub. Many different community organizations and partners are offering services through the Health Hub or associated with the Health Hub. And we just very much appreciate all their collaboration.
I'm looking forward to seeing you grow that, really expand.
Thank you. We are too. I think if it hasn't come out already, there's supposed to be a press release today. We were very fortunate to be selected as one of 11 recipients in the state designated as a health equity resource community. There was, I think, 60 or so applications for that. This is something that will award us $5 million of funding over the period of 5 years to continue some of the operations that we've established in the past couple of years. As you know, we had a grant from the state, the CHRC, the Community Health Resources Commission, the Pathways Grant, that allowed us to begin some of the operations at the Health Hub. That grant is now ending. This is the last fiscal year of that grant, but we are excited that we were able to get this new 5-year grant award to help us continue some of those established services. It's important because, as you can see, we've had strong utilization, and just like with anything new, it will take time for the community to become aware, for the community to get connected, and for us to start to see more and more people, more and more use. We've seen that this past year. We've definitely seen a rising use of all the different Health Hub services. So several thousand individuals have been connected in some way to Health Hub services and supports, and we're excited to be able to continue the service and expand the number of community members who could benefit. All the contact information is here if people want to get connected into the Hub or learn more about it. One of the most, I think we would all agree, most important issues is the health and well-being of our young people in this county. And it is something that we have made a priority at the health department to address and to work with our partners in our community in addressing. We have been working over the past few years to support youth mentoring in the community. We know that healthy relationships with positive adults as mentors can be incredibly meaningful to a young person, can help them change the course of their life sometimes, and can really give people a sense of connection when they've been feeling disconnected or isolated. And so we are doing two things. We are working with community organizations, including some of our faith-based groups in the county, to support them in developing their own youth mentoring programs. Two, we've launched this youth mentoring platform which is people can access through that web link highlighted in the corner to learn about what type of youth mentoring programs are available for young people in this county. We are adding on more organizations to that website, and they can reach out to us if they'd like to be included. And we're getting more and more young people connected to mentoring through that website. There's also referrals that are happening where our community partners are actually referring young people to this website and getting them connected to our Mentoring Connections program. Commissioners, last time I was here, and certainly you've heard it through the Sheriff's Office as well, we're very fortunate to have a strong partnership with our local Sheriff's Office and with others who have been working together to address the issue of group violence in our community. And we are looking at a variety of ways to prevent and mitigate the impact of violence on community members. So this is to let you know that our group violence intervention is hardy and strong. We are sending out teams often to individuals who've been involved in violence to provide resources to help prevent future involvement in violence and get them connected to resources that could help prevent involvement or address the reasons why people, particularly young people, are getting involved in violence. And so we're working very closely with our partners at the Sheriff's Office on this, and as well as other partners throughout the community who are helping with this. Part of our focus on violence in the community is, of course, to promote firearm safety. And so people can actually go to the website highlighted there to get a free gun lock. We have many firearm owners in our county, and we want to make sure that they're aware of and have resources to support keeping those firearms safe and out of the hands when somebody might be at risk for using it in a way that could hurt themselves or others. Just to give you an update, we had a very, very busy PERC season with our health department environmental health team. These are some numbers from what's happened during that 15 weeks. It was a long PERC season, so we were able to get a lot done and hopefully continue to support our homeowners and property developers in the county.
I have a couple questions on that.
Sure.
With the PERC process and the permitting process and all that stuff that goes through environmental health, is there, I've asked this before, I think, is there any way to close that 30-day window a little bit? You know, I understand the environmental health side is fully staffed now, and I figure with
we have a
fully
lot of
staffed,
trainees that we're
yes,
building
well,
up.
What kind of curve are we looking at to try to close that 30 days down? Because I get a lot of complaints. No, it's not going to say complaints. People bring up a lot of issues to me regarding holding costs for waiting on permits to come back. And then when they do come back, there's comments, and then you resubmit in another 30-day window. You got another month of interest payments to make, and then there's more comments, and then you're resubmitting and resubmitting and resubmitting and holding and not doing anything.
There's a lot of pieces to that process, and so I do want to say that every situation is different, and so if there are holdups in the process, I'd certainly want an opportunity to explore it and get back to you. And I know you've reached out to us, and other commissioners as well have reached out to us to find out what might be going on with a particular concern.
And like I said, when I reach out to you or I reach out to Logum or Medcom, I'm only hearing one side of the story when I hear that. So I have to tell you what I'm hearing to let you know that, hey.
Right. So we can look into it, and I appreciate that. It also allows us to, make sure you know all the different steps in the process well, and how all the different partners are involved. There's Logum, Metcom, others who may be involved in a particular processing of a permit or PERC situation. We are working really hard to make sure that we process things quickly when they do come to us. We, of course, have had, as health departments across the state, have had staffing challenges over many years now. And depending on the time of year, there may be other demands on the environmental health team. For example, in the summer season, we get a lot of beach and pool involvement. With PERC season, we're very focused on the PERC test itself. So yes, I mean, that is something that we're always concerned about. Is our workforce adequate to meet the developing demand that our county has on this matter? But again, there's many pieces in that process. Sometimes we're waiting for additional information to be provided. And so that may limit our ability to get things done in a certain timeline because we're waiting on particular organizations to provide their portion or waiting on a homeowner to provide their portion or whoever may be involved, a septic contractor, for example. So there's different pieces to that, and that's why I said every situation is individual. But I do want to assure you that we have every day our team gets stronger, and we do have our eye very closely on making sure we do what we can to process things as quickly as possible. We realize the impact it has on people's lives.
Being fully staffed in that particular department gives you a good leg up.
Yeah, and you know, but keep in mind we're developing that experience over time, right? Over the years, we've been understaffed for quite a long time. Health departments across the state have. But we are working on, as I've talked about before with all of you, the state's been working on improving the things that help retain experienced staff, like salaries and so forth. We've been working as a state to improve the pipeline of environmental health professionals. There's still not a lot of environmental health professionals in the state to meet the demand. And I wouldn't suggest that we're fully staffed as an environmental health division in the agency. I mean, there are definitely holes in our staffing. We are where we want to be at this point in time in terms of, compared to some of the gaps that we've had in the past. But even when we've looked at what type of development and what type of needs the county has as it grows for the future, we're going to need to continue to relook at what our staffing is for the different environmental health programs.
Well, staffing is important, but I do think that we need to improve our checklist on how we do things to speed up the process.
Sure, and
I mean,
there's got to
be things you do, and I'm concerned about your staff problems, but still, there's got to be a better procedure to work this thing. Another thing too is we just had a joint meeting with Metcom, and I think one of your staff members mentioned this that they gave out more holding tank permits in the last 2 years than they have in 20 years. Mm-hmm. So this concerns me. If we got that kind of a problem with whatever state regulations, federal, that we cannot put in-ground type systems in our community, then what are we doing? They mentioned about certain areas that are really having problems, size of lots or whatever. There's no way else to expand. Even a mound system doesn't work. So now we've got these holding tanks going in at an absorbent amount going in now. And this is costing people, we're talking about $300 to $500 a month just to pump out. So has not only you, but through our Department of Environmental Health and the state level and whatever, since we are surrounded by water, there's nothing we can do about that.
Absolutely.
I don't know if our land is sinking or the sea is rising. Whatever's happening, that's fine. But the thing of it is, what do we do with our wastewater and how do we treat it is going to be the very big problem. I can see it in the next 20, 40 years. And we need to start working on something right now.
Right. And there are, as you all are aware, there are ongoing efforts to try to expand connection and availability of connections for public sewer. That obviously negates
Tremendous
the need
cost.
for septic.
Tremendous
Yeah,
cost.
exactly. And so that's where this really needs to be a broader strategy that includes state support, I think, to address our heavy reliance here in this county on septic systems.
We need, and that's what we've got. And we're going to probably have to depend on that for a long time, except for these small pocketed areas that they mention. But we need to get somehow the state on board to say, okay, look, here's a treatment plant that works, a plant that we can put in a smaller one in these certain areas and help us with the cost of that.
Right.
And well, we also need the space too, so that's another tip because they do take up some space, these facilities.
Oh, yeah.
Thank you. It is summertime, and so of course our pool safety programs and beach safety programs are active now, and people can go to that website highlighted in the corner to look at if there are any current water advisories for public beaches. Ticks also is a major concern this season, and here in Southern Maryland we have a lot of ticks and a lot of tick-borne illness. So just a reminder, again, I know this is something people are familiar with who live down here, but it is really important to practice tick prevention, to check yourselves for ticks, to check your children and your pets for ticks, and to do what you can to get it evaluated if you do see an embedded tick, and particularly if you see any types of symptoms developing like a rash and so forth. I didn't include it on here, but we do have a website at the Health Department website that has some additional information, including information about where people can send ticks if they're interested in getting them tested. We had a really great, despite some heavy wet weather, we had a really great community baby shower this past spring. Kudos, of course, to our entire team that was involved in that. This is an opportunity for us to support growing families in the community, especially when economic times may be hard. A new baby in the family is definitely a financial strain, and so we do what we can do to support them with giveaways to support having diapers and crib, pack and plays, and so forth. A lot of that is coupled with education and resources, including information about local community partners to help them, to support them as they grow their families. We are planning another one in the spring of 2025. Coming up, June 27th is a free HIV sexually transmitted infection testing event at our health clinic in Leonardtown, and the information's here. People can stay tuned and come in without an appointment during that day to get tested. Thank you. As we go into the summer, we start talking about the next school year, and one of the things we need to prepare for is updated school physicals, updated vaccines for our children, and we try to help out, again, to offload some of the burden from our primary care providers in the community by hosting back-to-school immunization clinics for our community members. So just a heads up for the community to stay tuned, because we'll start to announce the dates and times of all those back-to-school clinics over the summer and after the school year starts. But some of the dates that we're projecting for July are already listed here. We'll be hosting them at our school-based health centers. And lastly, but certainly not least, because it takes a lot of partnership and work, is an update from our Healthy St. Mary's partnership. As you all know, commissioners, this is our county's local health improvement coalition. It involves dozens and dozens of community partners who are working together across sectors, both public and private organizations, to work together to improve health and wellness in our community. And so they set, based on data and feedback from our residents, they set a blueprint for that action, for like a strategic plan for improving health over some years in our county, and that's available at the website highlighted there. And they also, through their 4 action teams, which are listed in the green box there, through those 4 action teams, begin implementing some of those strategies from that plan. We have our annual meeting coming up on September 26th, and of course, we'll send out more information as we get closer, but invite any community member, any community partner to join us. Thank you, commissioners.
Thank you, Dr. Brewster. It's a very good briefing.
Appreciate all your time today.
Dr. Brewster, I did have one question.
Sure.
I think of these things too late sometimes. In the youth mentoring program, what age groups are involved in that?
So it varies. It depends on which organization people may be interested in utilizing for youth mentoring. Different organizations have different target age groups and so forth. Our youth mentoring exchange and youth mentoring connections program is generally targeted towards young people up through age 25.
Okay.
But certainly if somebody's...
We're not working with younger children yet?
Most youth mentoring organizations tend to focus on, older elementary, middle school, and up range. But there may be some that would work with younger children. I think the impact of mentoring probably is more appreciated and as kids approach adolescence.
Is middle schools are involved, because it's not just, so it's middle school and
correct,
and up.
Yeah. A lot of youth mentoring programs may even, take 11-year-olds, 12-year-olds, all middle school age kind of students.
Okay.
Thank you very much, Dr. Brewster.
Thank you. Thank you.
Doctor.
Appreciate your time.
I move to adjourn as the St. Mary's County Board of Health and reconvene as the Commissioners of St. Mary's County.
Second.
I have a first and second. All in favor?
Aye.
Any opposed? Ayes have it. Thank you very much, Dr. Brewster. And now next, we're going to have a public hearing. The Department of Land Use and Growth Management, public hearing amendments to St. Mary's County Code, Chapter 203, Building Construction, and Chapter 223, Article 4, Inspection Fees. And our Director of Land Use and Growth Management, Jessica, and I think you have, so I'll let you introduce everybody. How's that?
Good morning, Commissioners.
Morning.
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 For the record, I am Jessica Andritz, the Director of Land Use and Growth Management. And to my right, I have Amber Thompson Hardy, and to my left, the esteemed John Sterling Hauser, Deputy County Attorney. So we are here to conduct the public hearing as we requested. Uploaded in board docs was the information that was shared last time with 2 minor changes. There were some Scrivener's errors that we noted in the draft that had been previously submitted, and to facilitate your review of that, we uploaded what was called a red line document so that you could see the changes that were made.
Right.
I would say the most significant change would be to page 24 of 25 that provided a transition provision, something that we thought would be helpful in the administration of the amendments if they were to be adopted. And specifically, the proposed process would be as long as a person filed for a building permit application prior to the effective date of the ordinance, and they commenced work within 12 months of the effective date, they'd be able to continue under the 2018 standards, not the 2021 standards that are on the table for discussion.
Okay.
And that's about
Okay,
all
well,
I have.
first, is that all you have right now? Just with that, thank you. Okay, thank you. David Weiskopf will now provide the format for today's public hearing.
Thank you, Commissioner President Guy. Here are the guidelines for today's public hearing. All speakers who wish to address the commissioners are asked to fill in a sign-up sheet located in the lobby. All speakers will be allotted 3 minutes to address the commissioners. At the end of the 3 minutes, our Communications Director, Jenna Guzman, will let you know your time has expired. We ask that you respect the 3-minute time limit in order to give all those who wish to participate an opportunity to be heard. This public hearing is being televised live on St. Mary's County Government TV 95 and the county's YouTube channel. If you should miss any part of this hearing, it will remain available for on-demand viewing on the St. Mary's County Government YouTube channel. We will now begin accepting comments for those who have signed up to speak in person. And I was just handed the list, and it appears that nobody has signed up to speak in person. I do see some developers here. Certainly, come on up, sir. Mr. Gertz, I believe.
If you could please state your name and address for the record before starting.
It's Rodney Gertz, 750 Seagull Beach Road, Prince Frederick, Maryland, and with Quality Bed Homes. So just coming up to say that we had sat with staff and Jessica and Amber and appreciate their efforts in looking at this, because obviously as we bring any new codes in, as we talked earlier, talking about, even keeping housing affordable and home ownership possible. And it's heartbreaking to me as a builder to watch everything get added in. And I have my home, and a lot of other my homeowners do, but there's a lot of people that still don't. And it's sad when you watch it just steady, just as things get added in, you get pulled away. So, and working with Jessica and Amber, like there's things that, the 2021 International Energy Code, they have to be implemented. There's no way around it. There's no way. And there's other things that are, even how they're described, how they're interpreted, this and that, that you can take them one way or the other, and which could make it harder for people to own homes and more expensive, or it can go the other way. And there were several of those issues we worked with them where they were very, amenable to keeping St. Mary's as homeownership possible. Basically the dream's still alive as much as they possibly could. And so I was just here to say thank you to them and to let you guys know that we had sat. And I think sometimes in meetings like this, you don't get a lot of, the builders or wherever they will come in and say, hey, they did speak, or we have spoken to staff and they were helpful. So I was just trying to come and show my support for the staff and for you guys. And I know you guys are always looking to, as you said earlier, keep it where it is in grass for people. And as we know, that's getting harder and harder, and it's sad for our young folks. And so just wanted to show my support for what they've done to make, keep this, get in what had to go in and keep this as reasonable as possible. Thank you.
Thank you, sir, for your comments.
Mr. Gertz, I'd like to ask you a question.
Yep.
You do a lot of building in St. Mary's County, and thank you for doing that.
Yep.
The question we get from numerous people is, why can't we get affordable housing? Why can't we get $200,000, $300,000 homes that average people can afford? And my question to you is, do you think it's a question of over-regulation, or is it a question by the county, the state, whoever, or is it a question of just a cost associated with doing that kind of a home that you can't make any money, or I shouldn't say it that way.
Cost of material and
Yeah,
labor.
just the cost don't allow it to be in that neighborhood?
Yeah, right now it's a combination of both. Obviously, COVID made everything, all the materials just got ridiculous and still are. The only thing that's really come back is raw lumber. You can buy raw lumber close to what you could have bought it for in 2018 or 19, but that doesn't include trusses, it doesn't include I-joists, anything that was engineered. It's just kind of, I guess it's, right now we've got people stuck in the houses that have the mortgage rates that they could get at 3%. So the existing house market's not there, so it's still putting demand on new house construction, which is keeping prices up. You've got suppliers that are getting double what they used to get for whether it's PVC or whether it's a well. We used to pay, $8,000 for a well, and now we're paying $16,000 for a well just because of the PVC that goes in the ground and the new, the pump parts and material. So it's really, unfortunately, going to take a recession to help that. Or ironically, the Fed would have to bring interest rates down to get enough people that are stuck in their mortgage rate. They're not leaving a house when they have a 3% mortgage rate when they have to pay a 7% to go out. And that's just what's kind of in the press all over the country. And with that, it just keeps people buying the new construction, keeps these prices up. So it's going to be something that softens new construction to bring the materials down. But yes, over-regulation is the biggest chunk of that, and it just keeps adding up every year after year after year. And not that it's different product is different, has its different problems, but then you also have the economic kind of dynamic of when you're buying a property, you already have this excessive cost, whether it become an impact fee, whatever it's going to be on the low end cost of a water tap, a water and sewer tap. It's the same whether you're building a 1,200 square foot house or a 4,000 square foot house. So to make the economics work, you have to get the square footage to work on the open market. Kind of in the free market, that if I'm building 1,400 square foot houses like years ago in Herds Estates, whoever it would be, that you would think you could do that. I was on a $35,000 lot. My tap was $8,000, wherever it was then. And now when you're at the higher levels, you're forced to go to the bigger home to make the economics of a project work. So it's so hard to make housing work without the government support or whatever it's going to be that's going to ever be anything called affordable. And it's just which breaks my heart because I loved my days. We built houses. One of our starts was in Chesapeake Estates in Calvary County, but even Herds Estates in St. Mary's. And when I'd have people to buy a $120,000 house or a $100,000 house and be crying at the settlement table because they were so happy they never thought they could own a home. And now, you everything you're doing is $500,000, and it's heartbreaking. So, but I'd love to, anytime you guys are running outside of this and sit and talk about anything like that, ideals and that, I would definitely be up for it.
Thank you.
Yep.
Yeah, I'm shocked at the cost of building material. I've noticed that things like laminated woods have tripled in price in the last 4 years.
Yeah.
The waffle board, you call it, or the particle board, or the engineered beams.
Yeah,
it's just unbelievable.
And that's where the product that's engineered. Some of the other stuff's coming back, but some of the like trusses. We pay double what we paid for I-joists and trusses. For a 3,000 square foot house, it used to be $11,000 for the combination. Whether it's a Rambler or 2-story, you get more one or the other. Now it's $22,000, $23,000, and so I hope that comes off sooner or later. But I don't see any sign of it right now.
No.
So and who knows if it ever will. Yeah. So.
Well, thank you, sir, for being here, and thank you for your comments. Appreciate it. Thank you.
Thank you, guys.
Thank you, sir. Is there anyone else in the audience that would like? Mr. Evans, come on up. Welcome.
If you could start with your name and address for the record and speak directly into the microphone so everyone at home can hear you.
Thank you for that instruction.
He knows.
My name is Merle Evans, 44378 Fennicum Road, Tall Timbers, Maryland. So I'm here not to speak directly to what we spoke about with this public hearing, and certainly listening to Rodney with regard to what he has to do to make what he builds profitable. I understand that. I also understand that St. Mary's, as well as the rest of the country, is struggling right now with affordable housing. Our service industry folks that live here have no place to live. Very simple. I asked some realtors the other day, where in St. Mary's can I rent something under $1,000? They said nowhere. Just doesn't exist. So 9 months ago, the governor stood up a task force, accessory dwelling task force. I've been attending those meetings over the last 9 months. Their report's was due June 1st to the governor. And what it does, it addresses how we might, as a state, a country, a county, address accessory dwellings, allowing people to build dwellings within attics, garages, freestanding opportunities, those sorts of things. And a lot of the discussion was, do we do it by right, or we do it mandated by the state? Overwhelmingly, the consensus was we want to do it by right, which means you or I can go to land use and growth management, make application for whatever, and then we have to talk about easements and we have to talk about the rest. Biggest pushback from most all of the discussion was parking. A lot of places want to absolutely do away with their requirement of parking. I'm not so sure that's an especially good idea. Right now in Annapolis, there's some almost 300 accessory dwellings that are, their words, illegal accessory dwellings. We have tons of them probably here. I spoke to a gentleman the other day, put it in perspective, a family of 3 living in a rambler proximate to Patuxent River. Family of 3, a rambler, 3 families actually in the rambler. 3-bedroom home. Each family has a bedroom. They share common spaces, which is egregious enough, but understand there are 3 ramblers in a row that have that same situation. Unless we address affordable housing in St. Mary's, the people that do all those things that we get up in the morning, we go to get coffee, whatever, those folks are already there. They're already up, they're already working. Unless they find a place, and we can find a place for them to live, they're not going to live here. They're going to go someplace else. And that's a kiss of death for any community, to have service industry people having to go someplace
Your time
else.
has expired.
Thank you, and I saw
Please
the
wrap
zeros.
up.
I appreciate your time.
Thank you, Mr. Evans. Thanks for your comment.
Thank you, sir.
Evans.
Is there anyone else that has a desire to speak? Okay, seeing no one. Please note that the public comment period will remain open for 7 days until close of business on June 7th, 2024. Should the public wish to send an email to CSMC, St. Mary's County, md.gov, or U.S. mail to P.O. Box 653, Leonardtown, Maryland 20650. Commissioner President Guy, that concludes the comment period of the public hearing.
Thank you, David. With no other comments, we will now close the public hearing. Next, we'll go right into County Administrator time.
Oh, thank you, Commissioner President Guy. And as always, we'll start with the draft agendas for June 11th and June 25th, as there is no meeting on June 18th because of the holiday. And on June 11th, you'll start at your normal time and place, followed by 3 proclamations. One is for National Certified Nursing Assistants Week, one is for World Elder Abuse Day, and one is for St. Mary's County High School State Champions. Followed by County Administrator time, Commissioner time, and then tentatively closed session for boards, committees, and commissions. On June 25th, You'll start at your normal time and place, followed by a commendation for Virginia Quade's retirement, followed by a decision for the Department of Land Use and Growth Management, amendments to the St. Mary's County Code, Chapter 203, Building Construction, and Chapter 223, Article 4, Inspection Fees, followed by the Department of Land Use and Growth Management request for a public hearing for the Villages at Clark's Mills request for a water category change, followed by the Department of Land Use and Growth Management request for public hearing, sewer category change, followed by county administrator time, commissioner time, and then a memorial ceremony right outside for Tyrone Harris, adjourn, and then have an outside event for the dedication of the Chancellor Run Ball Field for Tyrone Harris. And starting with today's, is the Office of the County Attorney, real property with a Metcom easement at Wycomico Shores Golf Course. I see Miss Buffy Giddens, County Attorney, and George Erickson, Director of Metcom. Welcome.
Thank you, Mr. Weiskopf. For the record, Buffy Giddens, County Attorney. Do you want to introduce yourself, or are you good?
Oh, George Erickson with the Metropolitan Commission.
Thank you, Commissioners. Good morning. We're here today to present an amended easement to a part of the Wacomico Shores Golf Course area. If you have your packet, there's a pretty good picture on Mr. Erickson's memo from February that addresses easements 1 and 2. Currently on easement 2, there is a well that is older, and Metcom needs to build a new well, but there's not sufficient space on easement 2 to allow them to do that. So the proposal is to amend easement 1 to allow the construction of the well on easement 1. That would fit with the 50-foot setback requirement, and it already fits within the space of easement 1. An additional amendment would allow for fencing to be installed on that section of easement 1 as well. Do you have any questions?
I mean, you need to do it, right?
Yes, sir. The original well was built by the developer as part of the development. We all know there's a special taxing district associated with that whole property. The well's about 30 years old. We typically like to see wells last about 40 years. Unfortunately, this has prematurely failed. Every attempt to, what I say is rehabilitate, but if you talk to our water people, you have to use the term redevelop. You redevelop the well, you don't rehabilitate it. But for you and I, it's rehabilitate. We've tried to fix it, can't be fixed.
And what do you do, drill deeper?
No, we don't drill deeper. We have a water appropriations permit. We're in the Patapsco aquifer now, so this would be a replacement well in that same aquifer.
Okay.
Aquifers, the Patapsco is about 650 feet deep.
Oh, that's
and that's
pretty
what
deep.
we will be drilling. Unfortunately, that easement area 2 that's described is a 50-foot by 50-foot by 50-foot by 50-foot square. And according to Comar, your replacement well has to be 50 feet away. It's hard to be 50 feet away when it's only 50 feet. Now, when this easement was originally developed, those rules weren't in place. Somewhere between 2013 and 2015, Comar came out with new siting criteria for wells, 10 feet away from property lines, a certain distance from sanitary sewers, and part of all of that was the regulation to be 50 feet from an existing well when you replace the well. So unfortunately, although we have 4 different pieces of easement on county property, they're not sufficient enough to do what the intent of the original easement was to give us enough property to drill a replacement well. And that's really it in a nutshell. The other item that Ms. Gibbons brings up as well is there's an existing fence there that never was mentioned in the prior easement. So instead of just asking for permission to relocate our well, we might as well address an issue that never was addressed, the fact that there's an existing fence there that the prior easement did not give any authority to put. But it was there when it was conveyed. So we just wanted to clean that up as well. It's not really problematic, but you've given us authority. We don't want to overstep those bounds.
Oh, thank you. Well, I'm going to move to approve the amended declaration of easement agreement between the Commissioners of St. Mary's County and the St. Mary's County Metropolitan Commission for the installation of a new well located adjacent to the Wacomico Shores Golf Course, and to authorize Commissioner President Guy to execute all related documents.
Second.
I have a first and second. All in favor?
Aye.
Any disapproval? Ayes have it. Thank you all.
Mr. Erickson, when do you expect this new well to go in?
Oh, that's a very good question. First of all, it serves about 1,300 residents. Area 3, if you notice on the bottom left, right behind the clubhouse, there's a small area. That's our backup well. Any system that serves more than 100 families or 100 homes has to have a backup well. So if the well we're requesting to be replaced now, when in full failure, we still have a backup well.
Okay.
Just wanted to let you know that. As far as urgency goes, this is in our 2025 CIB. So we'll be bidding it in July, awarding it in August, and probably construct in September. What most people don't realize, it takes about 400 days from the time you start drilling to the time you get acceptance from the state to actually make it potable water. So that would be our schedule. Hopefully fall of next year, it'll be fully operational. About $300,000.
Thank you.
Okay, thank you. Thank you all very much.
Thank you.
Thank you so much.
Next up is from the Department of Public Works and Transportation, the SHA supplemental agreement for the Peg Road sidewalk federal funding. Deputy Director Gary Whipple, welcome.
Thank you.
Good morning, sir.
Morning.
Good morning, Commissioners. Good morning, Mr. Weiskopf. I'm here on behalf of the department to request authorization for our department to sign State Highway Administration supplemental agreement for sidewalk construction along Peg Road. As background, the State Highway Administration administers federal project funding through a 2018 Master Memorandum of Understanding that was adopted by the county back in 2018. So that gives you the framework for federal funding projects. That's analogous to general terms and conditions in a construction project. So when an actual project comes along, there's a supplemental agreement to add the project-specific information as a supplemental agreement. That's what you have before you. In the spring of April of 2022, the prior board requested congressionally directed spending to construct phase 1 of the Peg Road sidewalk retrofit project. And that was approved in the federal fiscal year 23 budget at our requested total project cost of $300,000. And this project will provide safe sidewalk system for pedestrians traveling along Peg Road. The $300,000, it is actually already fully funded in the existing capital project sidewalk retrofit projects. $300,000 is in transfer tax, and so we're also asking you to approve a budget amendment to create a federal funding line in that same project for the federal share. We need your permission to move money between funding accounts within a capital project. So there's a budget amendment for that as well. The scope of this project is the first phase. It provides sidewalk from Maryland 235 down to Ronald Drive, which is just short of the Jarbosville Run Bridge. So that's our first phase. In terms of schedule, State Highways has indicated to us that we need to have the plan specifications and estimate, which is essentially the bid document package. We need to submit that to them by May of 2026 for the funding to be obligated no later than September of 2026. So that's the schedule they've given us. But to give you an indication of how far along we are, the department has already received the categorical exclusion on the environmental back in February. So we've already cleared the environmental work. And the department has submitted the 100% design plans to SHA on the last day of April. So we're already ahead of the game on getting the plans approved. We have the environmental done. So as this supplemental agreement gets wrapped in, then we'll continue to add the federal specifications to the bid package and get it to them well before their deadline.
Does that mean that they could move up construction of this project, or is it still 2+ years out?
It's on our schedule. So yeah, so the dates they gave us were the dead stop. Okay. That's when we had to have it done to actually obligate the funding. So we're in good shape in terms of schedule. And I think the department's efforts to get the design done in advance of getting this supplemental agreement has assisted in that. So we're just asking for your permission for our department to sign it and then to let us move the funding out of the one funding line into the creative federal funding line.
Mr. Whipple, tell me, will this create a sidewalk along the entire length of Peg Road?
No, sir. It'll go from basically the gas station
Yeah, no,
there
I know
at
what you're
the-
talking about Jarvisville, but what about the rest of it?
The second phase of the project will construct the sidewalk from the bridge down to the Westbury intersection. And at the same time, the department is working on a roundabout design to resolve
Right.
the traffic at that intersection. And so you're right, it's part of a larger effort for the Peg Road corridor. In fact, this spring, we actually applied for two earmark applications, one for the new bridge, and then also for the widening of the road all the way back down to Chancellor's Run. When we met with SHA, they said, good job on seeing the need for the pedestrian bridge, but let's get the sidewalks built before we
agree.
move forward on the bridge.
So tell me, do we have it from Westbury down to Chancellor's Run?
No.
So would that be a third phase?
That would be, I'll get back to you on that. Yeah.
I guess my point is that what we've seen on FDR Boulevard is a lot of people walking. I mean, I'm amazed. It's really nice that you see the number of people walking in the evenings, and it just seems like we have a county road, we got to have a county sidewalk.
Right, and there'll be a crosswalk with FDR at Peg Road.
All right.
So,
well, as long as we have plans to put a sidewalk on
there
there.
are long-range plans, yes, sir.
Well, let's not make them too long.
Right.
We see what kind of timeline SHA is.
I get it. I get it.
2 years. I mean, if we can put the pedal down, let's
But
do
look
it.
what's going on at FDR. I mean, if you go down there in the evening,
Oh, it's beautiful.
Yeah.
yeah, a
People
lot of
walking their
people are
dogs
walking.
and families out walking. It's quite lovely. Well, I move to approve and authorize the Commissioner President to sign the related budget amendment and further authorize the Director of Public Works and Transportation to sign the State Highway Administration supplemental agreement for $240,000 of federal spending to improve sidewalks along Peg Road.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it. Thank you, Mr. Whipple.
Thank you.
Thank you, sir. Next up is the Department of Finance for the fiscal year 2025 cooperative agreement between the Maryland Department of Agriculture and the Commissioners of St. Mary's County. Joy Sapp presenting, Acting Director. Welcome.
Welcome, Joy.
Good morning. How are
Morning.
you doing?
Morning.
Okay, I come before you with the noxious weed agreement between us and the Commissioners and the Maryland Department of Agriculture. And this is presented on an annual basis. The program is fully funded by the revenues it generates. The program is set up the 530 miscellaneous revolving fund and pays for itself with no county funds. And in the event sprays are down or under projection, hourly employees generally work less hours, and the reduced expenses is offset by those revenues. And for fiscal year '25, it is expected that the program would generate about $70,000 in revenue.
Very good. I move to approve the FY 2025 cooperative agreement between the Maryland Department of Agriculture and the Commissioners of St. Mary's County for the continuation of the program for the control and eradication of invasive and designated weed species in St. Mary's County, and authorize the Commissioner President to execute the related documents.
Second.
I have a first and second. All in favor?
Aye.
Any disapproval? Ayes have it.
Thank you.
Thank you,
Thank
Joy.
you. And next up from the Department of Human Resources is the risk premium payment.
Uh-oh.
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 Director Catherine Pratson presenting, along with Risk Manager Rachel Pulliam. Welcome.
Welcome, ladies.
Thank you, and good morning again, Commissioners. So we are here to request funding from the Commissioners' Emergency Reserve for the fourth quarter premium for the FY 2024 legit bill. One of the challenging items with this premium is that we don't know the FY 25 premium, for example, until after July. So had we known this, it would have been incorporated in the budget process, last year. As many of you may be aware, it's a really challenging insurance market nationwide because of several items. And what we're experiencing in St. Mary's County is increasing county vehicles on the road with the increase of career EMS. We have recent additions to our property inventory, increased litigation, and then instability due to weather and flooding. So that, coupled with the national insurance market, we have seen an increase to the premium, both in FY24 and we anticipate another in FY25.
So, quick question, Ms. Pratzen. We knew about this increase last July, is that correct?
Yes, we received the premium in last July. We've decided to pay them quarterly because Legit offers credits. And Rachel diligently applies credits to this bill. And the most recent application of credits was, just a month ago?
Right, from the bus premium.
So we wanted to wait to present this because we didn't know the final amount due.
Okay, so that makes sense. So you needed to know how much credits we were going to get throughout the year.
That is correct.
Okay.
Right.
Understood. Thank you.
So, Ms. Pretz and Ms. Pullman, probably. I see on this Legit letter to us that this policy is about $1,250,141 a year. But they give us credits for loss control, property stabilization, primary rate, and it gets us down to $1,171,000. Still a lot of money. But my days back when I was a businessman, owner, is we had what was called experience modification. And it was all predicated on, okay, you get a number like, well, I wouldn't get $1,250,000, but whatever that number was, if my claims were up, I usually got increases for these claims, my experience ratios or modification, we called it. And it would increase my policy. These are lower, which is good in my opinion. So what has been our experience as far as claims? Have we had an increase in claims generally, or are we about the same, or are we keeping pretty, seeing that we have these negatives encourages me. It makes me think that you're doing, and thank you, we're doing a good job as a county. This is about a 0.97. Anything below 1.0 is good. But I have had years when I was in business, so I was at 1.1, and those were things I tried to combat. What's your experience here?
Well, it's a variety of things. It is increasing claims. Also, we're seeing a cost increased in repairs of our vehicles, and in property claims. Litigation claims have increased as well. And overall insurance market, as Legit tells us during our trainings in March, the overall insurance market is increased as well, those rates. So they have to, provide those increases down to their members. They try to help as much by giving us as many credits to each member, so to keep our insurance rates low. But it's just a variety of items.
A variety of things that are causing it to go up.
Yeah,
and again, I'm not
everything's
criticizing. I think it's actually, you've done a good job. I guess I go back to my days in business when, if my rates went up, my agent usually come by and said, Mike, look, what you got to do is worry about whatever caused them to go up.
Right.
They would give us indicators of what to look out for. And of course, when you're in private business, you always hate to make an insurance claim.
Right.
And you try and mitigate it before you get to that point, but sometimes you have to. So anyway, my point is, thank you, and I think you're doing a great job.
Oh, thank you.
Are these increases showing, over the past couple of years, are they showing a steady increase as something that we can try to build into the Commissioner's Reserve for next year? I mean, are we looking at another $100,000 to $150,000 surprise
Well,
I think that's a
We-
great question.
Every time we do our budget session, it's kind of like a guess. As you probably remember in FY25 budget, we stood up here and said I'm asking for a 32% increase for just for the Legit premium, and hoping that we have that, we've budgeted enough for FY25. It's one of those, we just hope we have enough in our budget. If not, we've got to come before you guys, so.
But there's no real trend to look at over the past several years saying that we are seeing like a, incremental increase over the years
Yes,
that we can build in?
we are seeing an increase every year.
Do you have a number on that? A percentage type?
Percentage-wise, it varies, depending on, like I said, there's so many different factors. I think I came in with FY24 with a 16% deficit. And so when I budgeted for FY25, I said, well, I'm already 16% in a deficit. I might as well tack on another 16% more for FY25, hoping we've got it
covered for FY25.
And you just came pretty close, but not all the way with that.
Right. So we won't know what our premium will be for FY25 until a couple days into July.
So maybe in July, you can let us know when
Sure.
that comes
Absolutely.
in, so we have an idea for what we're going to need to save for the.
I think it's pretty much trending with inflation. We've had such high inflation in the last few years that everything.
true.
Right.
Everything's just gone up.
Right. And it's
Unbelievable.
And it's, you know, one or two serious incidences and
Right.
So it costs more and more to repair things. It's gonna, the insurance is gonna have to go up.
She makes a good point. I remember when I was in business, if you had a serious claim, you know, that you expected you were going to have a jump. So you had to put a little bit more money aside. But if you had a normal year
Right.
and you thought you did pretty well,
Right.
then you always used to
Right.
pride yourself on thinking, well, I don't have to put more money in.
Right.
Yeah, I remember those days. Thank you.
Of course, insurance is prorated across the entire realm of insurance everywhere.
And then we're in a pool
We're in
with
that pool
legit.
type of thing with the rest of the country in sort of a sense. And
You're also in with the Board of Education, right? Are we in with the Board of?
No, I don't think they're.
Okay,
I don't
just
think they use
us and other counties?
Just the
So you
counties
look at-
and
yeah.
municipalities.
Yep.
I know the health is with the board. I think. Okay.
Yes, the
All right,
health is.
thank you.
Yes. Yep.
All right, well, I move to approve utilizing $100,000 from the Commissioner Emergency Reserve for payment of the FY 2024 fourth quarter legit premium and authorize the Commissioner President to execute the related document.
Second.
I have a first and second. All in favor?
Aye.
Aye. Any disapproval? Ayes have it. Thank you all very much.
Thank you, Commissioners.
Thank you, and that is all, Commissioner President Guy from the County Administrator.
Oh, my goodness, all we got. Okay, let's see, we're gonna move right into commissioner time, and we'll start with Commissioner Hewitt this time.
Oh, goodness. Well, thank you. So there was an interesting report this morning on the internet from Channel 7 News that Moody's, who we all know rates our bonds for the county, and they're very good at doing it, downgraded Maryland's bonds to negative. They still gave them a AAA rating, but they said what's going on in the state of Maryland is they're concerned about the structural deficits that are being built in by the new governor. Of course, the new governor claims it was the old governor, the former governor that did it. And the former governor claims, well, it's, you know, he left him with $5 billion surplus. It's amazing how these things go up and down. But the key is, it's back to what we've been talking about today, whether it's affordable housing or anything, insurance, anything we're talking about, it's just a higher cost. The higher cost of doing business, the higher cost of everything. So obviously, we want to keep an eye on our bond ratings. It affects our borrowing rates. But these are important decisions. And to see Maryland go to a negative bond rating by a major bond rater like Moody's is concerning to me. Last night I had the opportunity to meet with a family in Hollywood. It was a big family who I think they have 8 siblings, and what it was is that they have a big farm, and they want to know how to move forward with trying to get additional lots. It's in the RPD for their children and their grandchildren, and it was an interesting. I used the term. It's the best part of being a commissioner. It's called constituent services. Their ask of me was to say, what can we do with our own property? Look, we farm it. We've been farmers for years and years and years. Obviously, the people were there last night. 2 of them work. One just retired from the county a short while ago, and another one is retiring soon. But the point is, they're no longer farming. They got someone farming it for them. And the bottom line is they want to provide additional lots because they're restricted by Senate Bill 236 from 2012 that restricted them to 7 lots. So they're at a point where they're trying to figure out what to do. Now, I didn't have all their answers because they had many questions. But the point is, it's an opportunity for commissioners to get out with our constituents. Now, what I did do is tell them, we'll get them in touch with our land use people, in touch with our county attorney, people who can help them find a way forward. But at the end of the night, they were thankful that a commissioner would come out in the evening when they were off of work and they had time. And I want to just tell you, it was good. It was fun. I hate to use that term about county government, but it was one of the fun things we did, meeting with constituents. So, summertime's here. Lord knows, been out of town, but I'm back in town now, and doing some yard work the last couple of days, and it's hot and humid. Already, it's getting this way. So we've got to pay attention to our animals and anything we have outside, and try and take care of, just look out for everybody else when it gets hot. Lastly, Lord Calvert Trailer Park. People have reached out to me to say, what's going on with Lord Calvert? You had told us the decision was going to be made around June 1st about what these owners of that trailer park intend to do. I've reached out to them, but they haven't gotten back to me. I'm not sure what is going on. All I can tell you is I'll continue to reach out. Hopefully we'll get something resolved or something so people know what's going to happen to that area. But that's it for now. Thank you.
Thank you. Eric.
Very good. So this past week's been a busy week, and so first I want to touch on all of the graduation ceremonies. So congratulations to all of the class of 2024 graduates. I attended 4 different ceremonies last week. I know there were a few others, but I was at Rikens on Tuesday evening last week, and that had a little bit of an intermission with a lightning delay, but otherwise it was a beautiful, beautiful ceremony. Then Chopticons last Wednesday, and Principal Perner hit it out of the park with his speech again. He does phenomenal. It was very good. Leonardtown's on Thursday, my alma mater. It's always good to be back there for their graduation ceremonies. And then Friday at Great Mills. Great Mills had a wonderful graduation ceremony. They do a very nice program where they recognize their golden grads, the grads from 50 years ago in the class of 1974. Happens to be my dad's class, so they had several people there, Jeff McLean and my dad representing the class of 1974, the golden grads, so that was a lot of fun. And then they do a Hall of Fame at Great Mills High School, and they inducted Sean Davidson and Bubby Knott posthumously into the Hall of Fame, and it was very well deserving. It was a very nice ceremony, so it was a lot of fun and just an honor to be at all of those. This past Saturday was the Great Mills Road, their 3rd annual cleanup for the Great Mills Road, and a lot of fun and just a lot of hard work, but we had just beautiful weather all of last week, so that was very nice. And this was my 2nd year participating in it with my family, and we were doing the exact same section of road that we had done the previous year, and it felt like it was a little better off, so that's a good sign. Now, my son, who is 6 years old, wanted me to recommend to all the commissioners that we should put up some signs saying no trash and no littering, because he noticed the volume of trash that we were picking up, and he recognized it's not right. It shouldn't be that way. So I took that under advisement, and maybe there's something we can do with that. Then Saturday night, had a fun time at the Demolition Derby. It's just one of those kind of ridiculous events out there that's just a lot of fun, and it was enjoyable. It was a good evening to be out there enjoying that. A lot coming up too this weekend, the Crab Festival, so put that on your calendar. That's going to be great. And Leonardtown has a Hometown Heroes celebration Saturday evening, 5 to 9 p.m. So a lot of great stuff happening, and hope you have a great week. Thank you.
Mike.
All right, deep breath here. So we'll start off with, during the time off, I was able to go to a family wedding in Northern Virginia to see my wife's extended family, and that was a great time. It's always good to really reach out to those extended family members and hang out with them and just have a good time. Memorial Day ceremony down at Ridge, American Legion Post 255. We had a little bit of rain, but they compensated. We went inside the bingo hall area and had a fantastic little ceremony there. And like Commissioner Coleman said, we've had beautiful weather for the graduations this week. I think it was warm for the Chopticon one, and the weather broke for the last 2, and it was just you couldn't have scripted better days for those graduations. It was just amazing, and only one baby giraffe moment during the 3. Watching someone inexperienced with high heels trying to walk on an AstroTurf field. Hopefully we address the heels on those turf fields for next year's graduation. Pax River Museum. The mural rededication, the mural that was painted by 7th District resident, thank you very much, George McWilliams, was restored. It used to hang in the Officers Club. They pulled it down, they restored it. It's fantastic restoration job. The rededication was very nice. And the museum is great. If you haven't been to that museum in a while, do yourself a favor, go. It's really worth going and seeing the artifacts they have there. Reading the stories behind the astronauts in the early part of the space program as they went through Pax River through test pilot school. As hinted on earlier, with the increase in insurance, just to let everyone know that inflation does hit everybody. It does hit us at county government regarding our vehicles, our fuel, employees, and obviously insurance. My mother got a notice a couple weeks ago that her auto insurance was doubling. No accidents, no tickets or anything like that, but she got doubled. There's a lot that goes along with that, but to let you know, we up here do share that burden also. It's not just everyday citizens who are dealing with that. And to pick up with Commissioner Hewitt said about meeting with constituents is one of the main reasons that I wanted to be a commissioner is to be able to help people with problems and help them navigate through the county processes. There's a couple of county processes that I think still could be streamlined, and I think we're real close to getting those streamlined, especially when it comes to development and RPD on family property, on subdivided farms. There's always ways to improve communication. I really look forward to working with a lot of stakeholders to make that happen. And earlier today, we had employee recognition. And to me, recognizing your employees is very, very important to morale and lets them know that they feel appreciated. And during the public hearing, we had one of the speakers for the public hearing also praise our departments and the work that they do. And I share those sentiments. Our departments do fantastic work, sometimes very shorthanded, obviously, and underfunded, some would say. But I do appreciate all the hard work that all of our employees do. And I look forward to continue working with those employees and look forward to having a great weekend. And I'll pass it to Commissioner Ostro now. Thank you.
Scott, you got it.
All right. So definitely, a lot of it's already been said, but definitely a great time this past week attending. I wasn't able to attend all the graduations. I did unfortunately have to miss Riken, but I did make it to the Chopticon graduation, Leonardtown, and Great Mills. I did invite my daughter Kelly, who graduated from Leonardtown, to attend that with me, and she said no. Once was enough. But it was an absolutely great time. Just wonderful to see all the young people graduating and just at the beginning of their journey in life, and it's just was just absolutely fantastic. A lot of great speeches by a lot of the class presidents and the summa cum laude and magna cum laude and all of that. That was just absolutely wonderful to see. The way they speak about the future and their plans and things like that is just absolutely wonderful to see, and it was just an absolutely great time. So I look forward to doing that again next year. Again, with Commissioner Colvin this past weekend, we did the Great Mills cleanup, and I also saw that it was great to see much bigger numbers turn out this year. Last year was a little bit sparse, but we had a lot of great participation this year. Good to see that, and I did notice the same thing, Commissioner Colvin. The areas that we cleaned up seemed to be not as bad as they've been doing it for 3 years. I've done it all 3 years, and it seems to be getting progressively better every year. So I'm glad to see that. A big shout out to Taylor Smith and the CDC for everything that they've done in putting that on and in making sure that is a success year after year. So absolutely great time. I encourage everybody, come on out next year and help us, put back into the community. And it's not just
Great Mills Road. They have expanded it to where you can still sign up for it and you can do something in your own community. So it's not just specific to Lexington Park, Great Mills Road area. You can do wherever you are in the community, you can do something, and they'll support that and have equipment and things that you can take and use and bring back. So because I have had some folks say, it's just Great Mills Road, but they have expanded that, so that's great to see. So we can do a lot of great work within our communities where we live. So encourage people to look into that, reach out to CDC and ask questions about it, and get involved for next year. Also want to put a shout out. We talk about the wonderful things that our employees in the county do. I want to give a shout out to Director Shepard and his team. My granddaughter, Christine, has been absolutely loving playing baseball this year and absolutely loving and learning how to swim through the county's swim lesson program. She's having a great time. She's made lots of new friends. And it's just a wonderful time. She enjoys it. Her brother Thomas is going to be doing it next year. So absolutely fantastic program. And so a big shout out to Director Shepard for all the work that our Parks and Recs team puts into so many things that we have going on in our community for young people to do, from baseball to soccer to swim lessons to all the amazing things. I hear a lot that, there's nothing to do in St. Mary's County. There is lots to do in St. Mary's County. You just got to get yourself plugged in. You can go on the Recs and Parks website. There's so many amazing things to do in St. Mary's County. It's, absolutely, there's so many things, you couldn't possibly do them all. So I encourage everybody, get involved, get out there. Summer's just starting. There's lots of programs going on, lots of fun things going to be happening in and throughout the county. Unfortunately, this coming weekend, my wife and I and our whole family actually will miss all the fun things going on in St. Mary's County, because we'll be leaving Friday to fly to Texas for my wife's parents' 50th wedding anniversary celebration. And then from Texas, we're going to fly to California and be on a little bit of work travel for work, and also for a family reunion for my side of the family. So it's going to be a fun time. We'll enjoy California up in the mountains. So I will be Zooming into the commissioner meeting next week. My location will not be as good as the locations that Commissioner Hewitt zooms in from, but we'll see what we can do. So with that, everybody have a safe weekend coming up. As I always say, there's loads of stuff to do in St. Mary's County. Get out to the farmers market, support local business. So many things happening with the Crab Fest this weekend, and so much stuff going on in and around Leonardtown and in and around Lexington Park areas. So get out, enjoy beautiful St. Mary's. Hope everybody stays safe, and we'll see y'all next week.
Okay, thank you, Commissioners. Everything's been said about our graduation, but there was close to 1,200, I think, in the public schools alone that graduated. 1,200 students. That's a great number, and they all had great ideas what they're going to be doing in the future, and that's good. And I want to mention again our Leonardtown. I'm a member of the Leonardtown Lions Club. We will have our Crab Festival this weekend on the 8th of June, Saturday, at the fairgrounds. Please attend. And I will be at the gate part of the time, and I'll be at the beer wagon pouring beer. Look for the guy with the crabby hat on. That'll be me. And one person that was not mentioned during the years of service was Sharon Ferris, who had 15 years plus. She couldn't make it because she's not feeling too well today. She's had some eye surgery done, so she didn't make it, but we're going to miss her. She was definitely the person who kept me straight for the last 10 and a half years. So I'm going to really miss her a lot. Last but not least, probably my final Theo update of our grandson down in North Carolina. My wife has not been able, does not have to attend quite as much as she has been. Somehow the state of North Carolina has actually he's still on oxygen. He's still on feeding tube in his stomach type of thing and getting these medications. He's still getting it. Even though he weighs 15 pounds now, he's really growing great, but he's still unable to. This past Wednesday, they tried to put him on this first feeding through the mouth of actual foods. So the first thing they tried to feed him was mashed potatoes, actually mashed sweet potatoes, or pureed, wherever it was. He gave that frown on his face. We got to move him. He was not impressed about his first taste of anything through his mouth. Sweet potatoes didn't seem. I love sweet potatoes myself, but he didn't seem to like it too much. So he's still on formula for right now. They decided not to start him on regular food, but he's doing very well. The state of North Carolina actually provided a nurse that comes in there Monday through Saturday, 12 hours a day.
Nice.
She is there taking care of this child now, which relieved my wife of the duty that she's been doing the last 5.5 months. She's home right now going through withdrawals because she really fell in love. She's in love with the grandchild, but it's more you thought it was her own child the way she's acting, but she's having a little withdrawals right now, but she'll get over it. With that said, everything's doing well, and I need to have a motion to move into a closed session.
Quick question for you, Commissioner President Guy.
Question, yes, sir.
Does the Lions Club still use eyeglasses?
Yes, we do.
Will you have a drop box at the Crab Festival?
Well, we will have a vision hearing van there, and we will take glasses there.
Sounds
Yes.
good. I have 6 pair you can have.
Good. We'll take them. We'll take them. Okay. With that being said, I need a motion to move into a closed session.
I move to enter into closed session to discuss legal advice, real property, and personnel, boards, committees, and commissions.
Second.
I have a first and second. All in favor?
Aye.
Meeting adjourned. We're going to closed session.
All right.